Restaurant on Lincoln Road. Start your day right with our Desi breakfast every day from 7 a.m. to 1 p.m. Halva puri, channa, nihari, paya, paratha and omelette. Need a tasty lunch? Every day 1 to 4 p.m. we've got fast food, pizzas, kebab sandwiches, tandoori dishes, balti dishes, biryanis and much more. We're also open every evening 5 p.m. to 1 a.m. Try our Desi Tawa special or our fresh handi, 1 kg chicken or lamb on the bone, cooked to order. Eat in, take away or free delivery. Visit desirestaurant.co.uk to view the full menu and order online. 60-seat capacity and a private function room. Catering service also available. Desi Restaurant, 298 Lincoln Road, Peterborough, PE1 2ND. Call us now on 555 795.
Broadcasting 24 hours a day, 365 days a year. This is Salam Radio.
I'm just trying to find the pause button. Assalamu alaikum.
Walaikum salam, Shabina. How are you?
I'm fine.
Good.
Shahid Bhai, it's wonderful. I've just come online. And people of Peterborough, this is Dr Shabina Asad Kiyum for the Body Health and Mind Show on Salam Radio 106.2 FM. And we have our most esteemed and distinguished guest with us who said hello to you all before I have, which shows how special he is and how important he is to all of us today and to me especially. It's been wonderful this week, very cold. And Sister Michelle and I just had a bit of a laugh because I walked in my bedroom slippers because I'm so tired today that I was sat in the car and I parked up and I thought my daughter had left my bedroom slippers in the car and I looked at them and I thought, okay, no, I need these. So I put them on and I walked in and I thought, this is the comfort hour. It's the body health and mind hour. And we mean exactly just that. It's the body health and mind hour. My name, Dr. Shabina Asad Kiyum. I am joined by one of my most favourite clinicians and I'm going to go ahead and introduce him. He is our very own Dr. Shahid Latif, who's a consultant psychiatrist and clinical director at Northamptonshire NHS Foundation Trust. He's also chair of the Royal College of Psychiatrists Transcultural SIG, also the Royal College of Psychiatrists Advisory Appointment Committee and College Assessor, and the Executive Committee member of the Royal College of Psychiatrists of Trent Division. He's the chair of Northamptonshire NHS Foundation Trust Inclusion and Diversity Research and Innovation Group, the Trent Region International Medical Graduates Director, the GMC BME Steering Committee panel member. He is a member of the Association of Pakistani Physicians of Northern Europe. He's also a radio presenter of LRB Digital, and also for the BBC Asian Network panel of experts. And to add just to the end, I used to be his trainee as well back in the day. Assalamu alaikum, Shahid Bhai.
Walaikum salam, Shabina. Thank you very much for that introduction. I'm humbled, but you're very kind.
Not at all. I think this is far less than what I would have liked to have conferred to you upon. But you never know. The future holds great things and you've done so many great things.
Thanks to Allah. That's all I can say.
Alhamdulillah.
I've got more than I deserve. But yes, whatever comes our way, if we can do anything that we can help others and our community, then yes, why not?
Of course. And Shahid Bhai, tell me, what fuels this passion inside you? You have so much. You sit on so many boards. Alhamdulillah. What is it that actually fuels this energy within you to want to provide to the community and want to provide to your patients and those that you care for?
Well, you see, I always say this, and I say this to my trainees, I say it to my friends, I tell it to my colleagues, wherever we can. We all have our strengths and weaknesses, Shabina, and I don't think we should be ashamed of knowing what our strengths are and being able to own up to what our weaknesses are. Sure. I know, or I feel through feedback and my own sense, I can, one can have an understanding of what one can provide through what one has the abilities to do. And if I feel like I've given an opportunity on a certain platform to move forward, then I take it, I embrace it. And I suppose that's the way to do it. And I'm sure absolutely I see you do exactly the same. So probably you'll know what I mean. So I don't think there's any shame when people come forward. A lot of people say you're doing so many things. How can you divide? But you know what? As long as you are providing, for me, I think the main thing is as long as I'm providing and helping others. I've graduated as a doctor. That's our main bread and butter. And a doctor goes out and helps others. So when we are doing things and we are providing education, any kind of help, support, making people's lives better, and it doesn't have to be at a clinical level. It could be all different kinds of levels where you are looking at services, service development, etc., and also looking at some of the policies of institution and organizations like the GMC, like the Royal College, etc. And if you have the opportunity to take them up, why not?
Yes, and you have invited me to some of these transcultural conferences, and I have to apologise that I haven't been able to make any, but it sounds incredibly interesting, especially because of the communities that we live in. I know that you live in Leicester, I live in Peterborough. It has a huge population of cultural diversity, and I've had the pleasure of being on your show as well that you actually host in Leicester too. So there are very many common values between us, Shahid Bhai, and I think talking today a little bit to our listeners about these conditions that we've had a little chat about before coming on air is something that would be great. And for our listeners as well, for those of you who've just joined, this is Dr Shabina Sidqiyum with Dr Shahid Latif, a consultant psychiatrist. And it would be great if you wanted to text and WhatsApp your questions on 07745278978, or you can ring us on the studio telephone number on 01733 602 133. And you can watch us on Facebook Live, Twitter Live. We also Instagram and YouTube Live as well. So it'd be wonderful if you could join us. Now, Shahid Bhai, we wanted to talk a little bit. First of all, it'd be great if you could describe a little bit of the work that you're doing in terms of this Transcultural Committee in the Royal College of Psychiatrists. What does it represent? What are its aims and objectives for the benefit of different cultures that obviously have problems, probably understanding mental health in general? Is that what it's all about?
It is. The Royal College of Psychiatrists has almost about 15 or 16 special interest groups. Those include groups like international psychiatry. It has groups like women psychiatry, private practice, doctors in leadership, etc. One of them is transcultural. Transcultural means across all cultures, and mental health means the manifestation of different cultures, how they manifest mental health problems. And it is very, very interesting and very different how different cultures do manifest. It is a very well-known fact that individuals and you see this probably in your practice, in your GP practice as well, Shabina, that many Asians, especially from the previous generation, and maybe in the current generation as well, somatize or have more somatic symptoms. What we mean by that is that they manifest their mental health difficulties through physical symptoms, and that is not very uncommon. And one of the role of the Royal College of Psychiatrists is making attempts to understand how different cultures present. And we do this through education programs. We do this through qualitative and quantitative research programs. Every year we have an annual conference. I hope you can attend the next one. It's on the 2nd of March 2020.
Okay.
And I will be bothering you again and sending you the details. So hopefully this time you'll be there for us and join us.
Inshallah.
We normally get a very good attendance. And I'm proud to say that when I joined or became the chair of the SIG, as you call it, the Special Interest Group, about 3.5 years ago, the average attendance was about 50 or 60, and now we've touched more than 200, and our membership is, exceeding 5,000 members, which is the most successful transcultural group within the Royal College. And I recognise that because it is very, very important, and we've got a fantastic executive team. And we've got about 18 people. And what we do is, apart from our annual conference, we do educational programs around the country. We were just in Newcastle about 4 weeks ago, where we were invited to do talks and look at areas within that area of UK to get an understanding of how different cultural presentations come to the fore. They're not very different, Shabina. They're not very different. If you look at Asians in India, Pakistan, Sri Lanka, etc., the subcontinent, and also look in the UK, in America. I have been to the Middle East. I have been to America to present as well, and some of the cultural groups, transcultural groups there. The theme is exactly the same, so it's really, really interesting. So the same picture and the same story comes out.
Yeah. And it's so interesting what you're saying, because we've seen that the more awareness that you've created about this has naturally drawn an interest in clinicians and communities alike. And inshallah, I will be very privileged to come and attend in March at the next conference. I think it's so important, especially with the increasing exposure and the want to create this increasing awareness with mental health. Now, when we come to particularly the Southeast Asian diaspora, we have a look at before we go on to talk obviously about the conditions that we want to talk about, a very small level of understanding on these more serious mental health conditions such as psychosis and schizophrenia, thus leading to a lack of management and compliance as well with medication. Is there anything that we can do to help increase that understanding or help people actually register that this is something that we have to really educate people on, if anything? Because that's what I often find. I do really struggle as a clinician. There's a set way that these patients are managed. We're advised by our colleagues within the psychiatric teams. And often you will see that there are families from these ethnic minorities that really don't follow the methodology or the management protocol that is needed for stability. And then we find ourselves in a very difficult situation. And waiting times, obviously, to see a specialist are increasing, as you know, with cuts to the NHS and to mental health in particular. What's your view on this, Shahid Bhai?
Yes, you've already touched on very relevant points, Shabina. I think it would be, in order for our listeners to understand, just to give a broad understanding of what psychosis is. Mental health or mental disorders are basically broken down into two types. The first type we call neurotic or neurosis, and the second one is psychosis.
Sure.
Neuroses are where we have conditions like depression, anxiety, obsessive compulsive disorder, PTSD, etc. And one of the features of a neurosis or neurotic disorders is that individuals don't lose contact with reality. People are very much in contact with reality. For example, someone who suffers from depression knows they're suffering from depression. Whether they get treatment for it or not is another thing. Same for anxiety disorders. So depression and anxiety are two of the most commonest. And they may come in hand with what we're going to talk about now. The second type of mental disorders is what we call the psychosis, or the psychosis umbrella. Psychosis are conditions where individuals, when they do suffer from this disorder, lose contact with reality.
Right.
Now, what does that actually mean, losing contact with reality? Is where individuals, their perceptions of things, their concentration, their attention, their cognitions, which actually means their recognition of their surroundings, may be impaired. Now, some of the common diagnoses are diagnoses like schizophrenia, which is the commonest out of the psychosis. Then we've got drug-induced psychosis, which is psychosis caused by illicit drugs, substances like amphetamines, LSDs, cannabis, marijuana, etc. And then we have other conditions like schizoaffective disorder, which is a combination of schizophrenia and affective disorders, meaning a mood disorder. And then bipolar affective disorder, which may or may not be with psychotic symptoms, depending on how severe it is. Individuals who do have bipolar disorder, affective disorder, may not necessarily have psychosis, but it is seen that individuals can, and that's more the severe end. So psychosis as an umbrella, this is what it entails. The commonest symptoms and the most common form of psychosis is schizophrenia. And the symptoms of schizophrenia include, in no particular order, first of all, because they lose contact with the reality, there's loss of insight.
Okay.
So individuals, unlike the neuroses, don't know they're ill, and they decline engagement because of that very reason, because they don't feel. And many patients with schizophrenia, not all, but many patients with schizophrenia do end up, if they do end up in hospital, end up what we call becoming formal patients, meaning unfortunately having to go on a section for their better good. The common symptoms include hallucinations, that is a sensory perception or perception of something, like, for example, hearing something which may not be there. It could be your voice, it could be two voices, it could be music, it could be any kind of sound. And we have to tease out what these sounds are and whether individuals are experiencing them. Number one is by asking them, and number two is also by looking at the individuals and looking how distracted they are, because they may be looking around as if they're listening to something in certain directions where there's no sound. Perceptions may also be in relation to visual, so they may see things which are not there, and also the other sensories as well, like touch, taste, smell, etc., which are slightly less common, but are still can be seen in schizophrenia. So that's one of the symptoms. The second symptom is what we call delusions.
Right.
Delusions are when individuals, when they believe in something that cannot possibly be true. Now, what's really important here, Shabina, and I think that goes to our original discussion that we were having just a few minutes ago, is that a delusion cannot be diagnosed as a symptom if it's in keeping with the individual's cultural beliefs or religious beliefs, for that matter. For example, as Muslims believe in the existence of jinn.
Yes.
They believe in the existence of angels. Now, for someone who may not know anything about religion, and if you told them that I believe in a jinn, which is a realm or it's another entity created by God, which is made out of fire, if somebody's never heard of that, and this person is holding this belief with strong conviction, one can say, oh, is that person deluded? Well, they're not, because it's in keeping with their religious and cultural beliefs. So one of the definitions is that it must not be in keeping with the individual's religious or cultural belief systems. Right. So it's a very random thought. Like, for example, the aliens, I've been abducted by the aliens, and I can prove that by the light switch just went off, or the light just switched off. So there's no relevance there. It doesn't make any sense at all. Light went off and therefore I've been abducted. So it's a delusional belief. There are different kinds of delusional beliefs. For example, there may be paranoid beliefs that individuals are out to get them, or they're being watched, or their phone's being tapped, or the television or the newspaper is talking about them, or social media is talking about them. Might be the case. People might be talking about them, but it has to be corrected. So it's a belief which is not true. There may be grandiose delusions where individuals believe they have lots of money, lots of property, they're king of the castles, etc. So they have certain belief systems which are not there. There's nihilistic delusions where it's the opposite of grandiosity, where a person feels that they have no money, their insides, their guts are absolutely destroyed and rotten and gone, and they suffer from a physical health problem. And then reference, delusions of reference, which again is more to do with other people are watching them, etc. So there are different types of them. Also within the psychotic symptoms, we have other symptoms, like, for example, something which we call the passivity phenomena, which is individuals believe that their body, their mind, their thoughts, their speech, etc., is not within their control, and it's being controlled by an outside entity.
Right.
And then we have symptoms in relation to the mind, where individuals believe that their thoughts can be heard aloud by others, as if there's loudspeakers. So these are some of the beliefs. So if you really think about these symptoms, they are not in keeping with everyday living, everyday functioning. And for the average Joe blog, it sounds very bizarre. But unfortunately, that's where the individual loses contact with reality.
You've given such a wonderful, comprehensive way of the signs and symptoms that can be appreciated, obviously, with the psychoses. We have Sister Safira Houghton, who has just written a comment, actually. It's very relevant, Shahid Bhai. I'd like to share it with you. Really interesting content. So refreshing to hear a healthcare professional bringing in religious and cultural belief systems, which are very appropriate to consider when diagnosing Muslims in particular. Now, following from that, I know that you reiterated in the very beginning that it is separate or doesn't sort of conflict with one's religious beliefs or ideology, and you took the example of the jinn. But would it be deemed to be classified as a delusion if an individual said, just as you'd said, that rather than an alien, or to substitute that with a jinn, but a jinn has turned the light off and a jinn is controlling me? What are your thoughts on that? Because often within some cultural settings, when an individual suffers from psychosis, sometimes there is the concept that the jinn has taken control over this body and is telling this person what to do. And that is why this person has an episode as such. What are your thoughts on that?
Such an important question, Shabina, and thank you very much. And I think you've put it very concisely, and I think for the listeners, this is so important. The context of what the belief system is very important. You're absolutely right. Just the belief itself doesn't constitute a delusion. But there are a lot of things around it. And I'm going to give you an example. I remember when I was training in the Republic of Ireland, and a lot of the individuals, their delusional system, especially their paranoid delusions, they often would talk about the IRA. You see? Now, IRA is not a made-up term. The IRA, the Irish Republican Army, were actually real. So a lot of people would feel that the IRA is watching them. Now, the IRA is real, but the context around that is a delusion.
Yeah.
You see? Similarly, in the early 2000s, when it changed around and we came to the UK and we were studying, and guess what was the next, paranoid entity replacing the IRA? It was the Al-Qaeda.
Okay, right.
And we saw a lot of individuals who would feel that whenever their paranoid delusions came to the fore, they would talk about Al-Qaeda, or Al-Qaeda is watching, or the Taliban, because this was on the media, and obviously individuals, they absorb, they perceive, and some of the delusional belief systems revolve around what they learn, and it becomes a delusion revolved around something which may be real. So similarly, believing in jinn for a Muslim is not necessarily a delusion, but anything else around that can be taken as a delusion, provided we do a good history of getting an understanding around jinn. Now, for example, if somebody says that the jinn has switched the light off, now the light may have gone off, and an individual may believe it's the jinn that's doing it, or you may have a power cut, and the individual may believe that it's the jinn. There is a very thin line. You see, first we have the belief system, which is within keeping with the cultural and religion beliefs. The next step after that, you have an ideation, which is something which is so strongly held, it's slightly bizarre from a normal thought process, but it's more towards the middle. And then next to the ideation, you have the delusion, where it's complete lack of contact with reality. And that's where delusional system and belief kicks in, where the person holds that thought with concreteness. And when we do discuss this with individuals, it's not just the content of what they say, there's a lot of other things going on as well around the person. You know, their recent history, 2 years earlier or 1 year earlier. There's issues in relation to how they've been functioning. For example, prior to that, individuals, if they're students, their grades may have gone down. If they're working, job performance may have been an issue. Their self-care may have been affected. Their thinking process and concentration may have been impaired. They may be generally suspicious about people around them, including family members or relatives. They may be spending more time by themselves, that is, being more isolated. And their whole emotionals may be either too odd or have no feelings at all, or inappropriate. So it's not just the belief, there's a lot of things around it, Shabina, which are also important. But also to add, one of the things that can cause, the commonest causes of psychosis is the use of illicit substances. So obviously, if there is the use of illicit substances, and there is a complete change in behavior, then obviously we would need to very strongly think about whether that's the cause of the change in the behavior and the thinking process.
Right. I think that you have touched upon so many important aspects over here, obviously cultural being one of them, but also other influences as well. Medication, for example, and illicit substance abuse, which is something that we are tackling here within communities. In bigger cities and more so, it's increasing in smaller cities, just like here in Peterborough. And I won't make any reservation of the fact that I have seen some very young patients who have developed psychosis as a side effect, for example, which was quite surprising, to retinol-based, for example, isotretinoin medications for acne. And I remember the case of a patient, a very, very promising future, who all of a sudden sort of was subjected to this psychosis. And I remember the look of despair in his mother's eyes, that all of a sudden I have a grown-up son, very promising future, now we're faced with this, and how helpless she felt. And we've got 60 seconds to go to the break, Shahid Pai. It's wonderful. Sister Michelle was trying to bring your video on. Your video came on towards sort of the end, but it's great that we have you here. What I think I'm going to do is, we've got quite a few questions actually popping up. Well, after the break, we can talk a little bit about the management, if that's all right with you, Shahid Pai.
Of course, yes.
And how we can address this, what support systems possibly would be good to put in place in such communities as well for the psychosis conditions. And hopefully, inshallah, we can come back, talk a little bit more about this, take some questions from the floor, and have your wonderful expertise. I see it seems as if you're still at work, and thank you very, very much for your time. And then we won't realise the time will go by. We've got 9 seconds till the break, Shahid Pai. Thank you very much for remaining with us, and all of you listening in the audience, wonderful show. Please don't go away. Join us after the break.
Stay tuned to Salam Radio after this short ad break.
It doesn't take much to bring some difference. You give some change, which makes a change. Because nothing gets mileage like a charity. Just a little change turns into a chain. And before we know it, the results are massive. So give a little to make a big difference. For donations, call now. UKIM 0207 387 2157.
Had a car accident or an accident at work? Accident specialists are experts in no-win, no-fee accident claims. Leave the hassle to us. Our multilingual settlement experts will manage the entire claims process on your behalf, with nothing to pay up front. We provide services such as credit hire, taxi vehicles, recovery, storage, and much more. For full details on our range of services and a free consultation, call us on 01733 555 774 or visit our office at 249 Lincoln Road opposite the NatWest Bank. Accident Specialists. Start your successful claim today.
Do you own a restaurant or takeaway? Cater Fair is an expert supplier of new and used commercial catering equipment. Visit caterfair.co.uk for quality equipment on sale at the lowest prices, or call us on 01733 310 115 or visit us at 11 Royce Road, Fengate, Peterborough.
जब बात हो हलाल मीट की तो कैसे मुमकिन जिक्र न हो हाजी बाबा का। हाजी बाबा अज़दा में आपके लिए। हम अज़दा में अरसा 10 साल से जायद मुल्क भर में 45 से जायद काउंटर्स के साथ बेहतरीन पैकेजेस, हर वैरायटी का मीट और आला मायार के लिए आइए हमारे पास। चिकन ब्रेस्ट, चिकन क्यूब या कीमा सिर्फ 3.99 पाउंड पर केजी, लैम या शीप लेग, लैम शोल्डर और मिक्स सिर्फ 6.99 पाउंड पर केजी, बेबी चिकन सिर्फ 1.99 पाउंड पर केजी। आपकी सहूलत के लिए वक्त की बचत और मायार की जमानत, तमाम हलाल गोश्त और अशिया जरूरत एक ही छत के नीचे। हाजी बाबा हलाल मीट, फाइंड अस इन अज़दा।
Gems and jewels, wise sayings, interesting events, and moral lessons from Islamic history. They were trying to make him angry.
Ahnaf ibn Qais was famous for his forbearance and patience and for not becoming angry. Some of his companions gathered together and decided that they would try to do something to arouse his anger. One of them went to him proposing to marry his mother. Ahnaf said, "We are not rejecting you because we think your status is too low, nor because we lack the desire to be related to you through marriage. Rather, it is because my mother is old in age. She is almost 70, and you are a young man in the prime of your youth. You need an affectionate and fertile woman who will take from your manners and learn from your character." He then said to the young man, "Return to your people and inform them that you are not able to make me angry."
Bismillah. قال النبي صلى الله عليه وسلم الدعاء مخ العبادة. The supplication is the essence of worship.
You're listening to Peterborough's community radio, Salam Radio, 106.2 FM.
Assalamu alaikum and welcome back to the Body Health and Mind Show with Dr. Shabina Asad-Qayyum on Salam Radio and Dr. Shahid Latif, who is Consultant Psychiatrist and Clinical Director of Northamptonshire Healthcare NHS Foundation Trust. So before I move on, I'm just going to say Assalamu alaikum to my mum who's tuned in all the way from Pakistan. Good to see you again today, says my mum. Definitely watch the video. Hi Shabi, very good topic. Very interesting indeed. So Shahid Bhai, there's my mum listening all the way from Pakistan. So I'm going to give my mum a shout out and dedicate this show to you, mum. Love you very much too. So it's wonderful that we have so many people that are listening to this show. Now, Shahid Bhai, before the break, we were having an extremely interesting conversation about signs and symptoms, etc. And there are some questions that are coming through that I thought that we could talk about before talking about management. Now, one of them is that you sometimes see, without any precipitating factor, in an individual who otherwise has no previous significant medical history, isn't on any medication, lives a very active lifestyle, and then around about sort of late age, with looking at 50 plus, 60 plus, develops psychosis. Do we know the trigger factor for these type of psychoses? And that's a question from an anonymous, somebody who's asked.
Yeah, I mean, psychosis, the commonest age of individuals, if there is no cause for it, the commonest age for males and females is males are late teens, early 20s. Females are slightly later, mid-20s to late 20s, maybe early 30s. That is individuals who do not experience, and those who have a genetic predisposition. It's not very common for individuals to develop psychotic symptoms at a later age due to genetic reasons. I'm not saying that it's never ever seen, but it's not that common. There may be a number of reasons why, if psychotic symptomatology does come to the fore, there may be a number of reasons. One of them could be early dementia.
Okay.
Now, it's not uncommon for individuals who do develop some dementia to also develop psychotic symptoms as well. And when we do talk about dementia, there is not just one type of dementia. Alzheimer's is just one of them. We have other types of dementia, for example, temporal dementia, where psychosis is quite common. And then we have Lewy body's dementia, etc. So it depends on the different parts of the brain where it occurs. So dementia is one of them. I'm not saying it is. It could be one of them. Stress, trauma could be another one, where individuals do experience something. Now, when we talk about stress, it doesn't have to be stress to the extent where it's so severe that one says it has to be this. You see, different individuals for different reasons can experience or manifest their symptoms even to the minor of stresses. Now, we don't know that that stress might have been building up. We don't know that it may have been a cluster of myriad or a myriad of small stresses which have built up to the extent where the person has had a breakdown, to the extent that they start developing symptoms where they are not keeping in contact with reality. Trauma, as you said, from stress is another one. The use of drugs also, although it's not very common at a later age, but it's not unheard of. The use of alcohol can also be another factor. Traumatic brain injuries are quite common to develop psychotic symptoms, depending on what part of the brain has been affected. And also conditions like some space-occupying lesions. One of them being like a tumor, you know. One of the things that I would do as a clinician is that if an individual did develop psychosis at the age of mid-50s or later, one of the things, and after having ruled out any trauma or stress or drug use, etc., I would request a CT brain to rule out any space-occupying lesion.
Wow. Okay.
Yeah.
I think that's really significant what you've just said, because often we look at the psychosomatic element of individuals developing symptoms such as that, but definitely I think that's really pertinent. So I hope whoever's asked that question, it's to a degree explained and answered some of the queries that you may have. The other thing I'd like to ask, Shahid Bhai, is something that is asked very commonly. Is psychosis and schizophrenia curable?
Okay. Now, again, it depends on the cause of the schizophrenia or the psychosis in the first place. Individuals who do have experience, if it's stress related, if it is trauma related, if it is drug related, if it is alcohol related, etc., or when we talk about a space occupying lesion, we're not necessarily talking about a tumor. It could be anything. It could be an abscess, etc. So if we're talking about those conditions and those causes are factored or treated, then yes, it is. There is something else I suppose is important, and I suppose as a GP you'd be really interested to know, or you may have seen certain cases that, and I've seen quite a few cases, is something which we call steroid-induced psychosis.
Okay.
It is not uncommon for individuals who start steroids, any type, it could be prednisolone as well, may develop psychosis as well. It's not uncommon. So it's something to look out for individuals who are started on steroids. But there are certain types of psychosis which are more genetic based. Now, if anyone's parent has psychosis, if both of the parents have genes for psychosis or schizophrenia, there's a 40% chance of the offspring having psychosis. And one of the way of looking at that is, even if the child is separated or adopted by parents who don't have psychosis, but their parents, both of them did, there's still a 40% chance. So that's how we test that, whether genes play a role.
Wow.
Now, when genes are there, it's not necessary that the individual will definitely develop psychosis. But the gene is there and it may be dormant. It might be sleeping or might be quiet. And certain things like stress or trauma may wake it up.
Wow.
And that's where individuals may develop that. So they may have had a dormant gene, but it has been it's woken up because of that stress or the trauma. So they were always primed to develop it, but they developed it because of a certain cause. Now, individuals who have a genetic basis and who develop psychosis, psychosis becomes a bit more like conditions like hypertension, diabetes, rheumatoid arthritis, in which we can ask the same question as you have, Shabina, that is it curable? The answer is no. However, it is not uncommon to see individuals, when I say it's not uncommon, that means it's not the norm, but it's not uncommon to see individuals who have managed their schizophrenia for years and years, and they ultimately come off medication after 15, 20 odd years. It's not that common to see that, but we have seen that. But in majority of the cases, individuals have to remain on medication in some shape or form, just like diabetes. But you see, we have lots of patients, Shabina, and I think for your listeners, it's important to know that provided you are maintaining the right treatment. Now, when I'm talking about treatment, I'm not just talking about medication, because medication isn't always the answer. Medication is part of is a spoke in the wheel of many other things.
Yeah.
Individuals can continue to maintain high functioning. The only thing is that the psychotic symptoms do have an impact on concentration and attention, and that is something that may be affected. But individuals can still continue to work. They can still study. People with schizophrenia or psychosis are not less intelligent than individuals who don't have the condition. However, because of the impact that it can have on concentration and attention, it can affect things like education or kind of work that they do. So individuals who do have psychosis, because of more genetic, it is there for many, many years. And the most important thing is how to make sure that it's being treated correctly so that, that the individual can continue to maintain their life as they want.
That's right. I think that's so important, Shahid Bhai. And actually, whilst you were saying that, a comment has come up on my own phone by a sister who has said that she would like to give this message, that often, because we have those that we care for who suffer from psychosis or schizophrenia and are on medication, we also fail to treat them like individuals as well. So, for example, if they come across with a complaint that they're not feeling well, or they're not feeling right, or they want to do something, or want to apply for a job, because we automatically assume that they are suffering from a psychosis or a schizophrenia, we tend to take them less seriously and actually hinder their ability to go for something that they have an ambition to achieve. And that can be quite detrimental as well, can't it?
Absolutely, Shabina. And I think one of the things that we do provide training, and we do work with our GP colleagues. Obviously, you've heard of the term parity of esteem. And it's really, really important that individuals who do have psychosis and have become unwell and may have been admitted into hospital and are on antipsychotic medication, they can also develop physical health problems. In fact, because of the kind of medication they're on, it can cause things like metabolic disorders, cardiac problems, diabetes, etc. And it's really, really important to take these very seriously. It's just like any other medication. For example, someone with Parkinson's disease, the medication for Parkinson's disease has a lot of side effects, and we have to manage and assure that the person who is taking the medication, we adjust the medication in such a way that their functioning is as good as possible. Similarly, individuals with schizophrenia, we have to take the medication that they take and the side effects they may experience very seriously, and their physical health condition very seriously. Because if we don't, then it's a known fact that individuals who are not cared for properly, or those who do not manage their schizophrenia well, have, unfortunately, their life expectancy is less than individuals who don't have schizophrenia. But that's not for every case. That's why it's so important to understand the symptoms. And I think there's another important thing which I suppose is really important to highlight here, is that something which we call the duration of untreated psychosis. And that is the time when individuals the family ignores that the individual may be suffering from a psychotic symptom. And for whatever reason, whether it's cultural, whether it's religious, whether it's a stigma, or for whatever reason, the longer that psychotic phenomena is left untreated, the more difficult it is to treat.
I think that was very well said. And before we move on, Shahid Bhai, I have a question from Dr. Saqib Ghani. Dr. Saqib Ghani is a wonderful colleague who's also come on to the show. And he's asking, is exercise a good remedy for patients suffering with stress and depression? And if yes, should the government help fund the NHS so that exercise sessions can be prescribed to such patients? For example, subsidise memberships to gyms, provided patients adhere to it.
An absolutely $1 million point made by Dr. Saqib Ghani. This is so important. When I said earlier on, Shabina, that medication isn't the answer, there is a number of things which an individual with psychosis, things like medication, psychotherapy, if available, family education, social support, vocational support, accommodation support if required, and last but not least, physical health, exercise. Absolutely right. There's something which we call social prescribing, and slowly but gradually, mental health services are starting to take this very seriously. Again, I remember when I started off my training in the Republic of Ireland, we were at the cusp of when we used to have those institutions in the going right, went on to the early 90s, late 90s, and then it went from there more to community-based. And I remember the hospitals used to have things like farms and the outdoors, etc., the exercise outside, not indoors. But then they moved away from that. Social prescribing means very much that, where we get individuals to have a structure to their day, to have an exercise regime, to make sure that their legs are well oiled and their arms are well oiled and their whole body is well oiled because they're moving and the mobility is there. So absolutely like what Dr. Saqib Ghani has touched on is absolutely right, and I advocate not just with individuals with who have a diagnosis of schizophrenia, psychosis, but any mental health condition, physical health, exercise, the outdoors is so important. The previous page where I don't know whether you follow me on Twitter or not, but I normally put this up on my Twitter account. Just recently, within the same trust, I'm now doing inpatient care, but I was doing community care for about 11 years. And one of the things that we had set up is that we had went through a charity and we bought an allotment for our patients. And that allotment was basically majority of our patients would go there on a daily basis. It was almost on half an acre of land.
Wow.
And they absolutely loved it. And the patients who would be there present and they would work, they were, what they actually did for themselves, for their health was absolutely fantastic. So yes, absolutely. Physical health, physical exercise, very, very important.
Wonderful, and very, very articulately put, Shahid Bhai. And Dr. Ghani, you might be happy to know that here within our own city of Peterborough, public health actually does have these exercise programs that we've had in the past couple of years. Let's get healthy, let's get moving, in which for a very minimal charge, patients can be referred by their GP to an exercise program to help them, especially in this area where we've got an epidemic with diabetes and heart disease, and to help them control their weight. So just as Shahid Bhai has said, it is essential actually, and Shahid Bhai has given such a good example of how exercise can help patients within his own trust too. Now, Shahid Bhai, let's move on to treatment. We're so short of time. We always run out of time on this show, but I'd really like us to touch on treatment. So you have a patient that comes to you who presents with psychosis, and I know that every case is individual, and according to each and every case you have to spend an awful lot of time taking a thorough history to see where this actually stems from, what plan will be in place, and how long the duration is, obviously having a look at many factors. Now, what are the common medications that one places these patients on? The reason why I ask that is because we have a couple of people that have sent in questions stating that often we see that our relatives are put on medications who are suffering from schizophrenia or some type of psychosis. Unfortunately, it's very difficult initially to try and see or have a follow-up with our consultant because they often see them either on a 6-monthly or yearly basis. Is there anything to worry about in that frame of time?
I would be extremely worried if individuals who are not settled, if the appointment is 6 months to a year. Now, obviously, as NHS service are there, if an individual's unwell, they need to be seen ASAP. We have various aspects to treatment. The first, depending on how severe the symptoms are, if they're quite severe, obviously they don't go to the main consultant, they go to what we call, and you'd be aware of, we call the crisis team.
Yes.
And they treat the patient initially and then refer to the consultant. Now, depending on, ideally in an ideal community mental health team, that should be as soon as possible. But obviously there's delays due to resource issues. But ideally, that's what should be the case. Ideally, if they are suffering from psychotic symptoms, they should be started on medication as soon as possible. Now, as you're probably aware, Shabina, there is a what we call NICE guidelines, National Institute of Clinical Excellence guidelines, and they are guidelines, but they are there to be followed, where certain type of antipsychotic medications are started. Like I said earlier on, like any medication, antipsychotic medications do have their side effects, and some of the commonest side effects could be related to, their heart. They could be related to their metabolic, like cholesterol levels, etc., diabetes. So we need to do a baseline test of an ECG, baseline test for their liver function test, for their kidneys, etc., and also baseline for cholesterol and sugar levels. And this should be followed up. Within 6 weeks, and then 12 weeks, and then yearly, on a yearly basis, provided they are settled. So it is very, very important initially that there is hands-on treatment for individuals who have been diagnosed with psychosis and schizophrenia. And I think it's important to mention that individuals, there are most of the trusts around the country have what we call early intervention for psychosis. And each trust has different names for them. So what it actually means is that any individual who's between the age of 15 to 35 and who develops psychosis for the first time, in order to assure that these individuals receive the right protocol and the structured protocol, these services take these patients on. And they're under their care for about 3 years to assure, and it's very much to assure that they go through the structure, through this process. Now, not every trust has this service, but majority do. But if an individual is not under the care of early intervention for psychosis team, then the psychiatrist who's in the community mental health team, there is a protocol. Every team has that protocol. It's based on the NICE guidelines, and that should be followed. If it's not followed, I would be very worried.
Yeah, and I think that it's important to obviously establish that compliance is also key in between all of this as well. Often what happens is that, yes, it's natural to accept that not every medication will work straight away. There is a little bit of a washing in period, settling in period for medication, especially with antidepressants, but even with the more intricate medications. So it's important to establish that with patients, which I'm sure the specialists do, whilst laying out a management plan. Do you think, Shahid Bhai, that because of the lack of funding sometimes, do you feel that there is more scope for seeing these patients more regularly if the capacity allows, or do you feel that capacity at the moment is adequate?
There's always room for improvement. As you know, the NHS is there is struggles in as far as resources are concerned.
Sure.
You being a general practitioner, you know very well. I mentioned the word crisis team.
Yeah.
One of the things that GPs pull their hair out is the referral process and the pathways, etc. There's room for improvement always. Early access, targeting individuals to the right service is very, very important. And services do fall down. They do fall down based on, and there could be many reasons for that. One is, do we have the structure and the pathway right? Number two, the resources, the services may be there for very well-intentioned purpose. However, due to lack of resources, there may be delay in getting access to the professional or the professionals or people within the team. But we have to keep trying, and I think it's really important for family members to make sure that the first thing to do is to make sure that they are seen. I'm really stressing on that because delays can cause problems, and it not only has an impact on prognosis, it also has an impact on how quickly they will respond to medication. And obviously, as you've highlighted about compliance is really, really important. And yes, one of the reasons why individuals do become compliant is because they feel medication isn't working. One of the things with medications, as you touched on, like antidepressants, particularly, and also medications like antipsychotics, may take a while to kick in because they have to build up in the system. They have to reach a steady state, and only when they reach a steady state do they start offering their maximum therapeutic benefits.
Yeah, and I think that that's key. Compliance, especially within our Southeast Asian diaspora, who feel that sometimes if they see a little hiccup whilst taking the medication, which is obviously may happen in many cases, it's a sort of panic mode kicks in, and then all of a sudden it's about either stopping the medication, that no, this is causing side effects, etc. And I get that all the time, and it's very frustrating because then it prevents the stabilizing of that patient as well. And often we're faced with a scenario where we have to then signpost them to the crisis services, etc. And it can be very difficult for the family members of that patient too. So most certainly, I think you've given a really important message here, Shahid Bhai. Now, whilst we're coming up to the last 2 minutes of the show, well, we are in the last 2 minutes of the show, do you have any golden nuggets of information to give our listeners, especially with regards to transcultural perceptions of schizophrenia and psychosis? Some golden nuggets of information that you feel that they need to hear.
Yeah, I think one of the people which is always in people from a cultural perspective is this jadoo, is this nasr, is this black magic, is it jinn possession, what is it? I say that's fine. That's fine. If you have that belief system, don't be afraid to say so. Yeah. Because one of the reasons for lack, and we did a study which was published in 2011, and one of the things that we came is that because people did not want to talk about it is because they didn't want to be seen as superstitious. They didn't want to be seen as backward. Yeah. Now, it is schizophrenia, psychosis, and cultural beliefs are much better understood. Yeah. Talk to someone. Come to the fore. Yeah.
20 seconds.
So yes, my thing is, if there are any doubts, please do, if you want to see your religious leader, do so, but please do not ignore these symptoms, because it could be more than what they actually believe it is.
Shahid Bhai, thank you so much in the last 10 seconds. You're the best psychiatrist in the United Kingdom, and hopefully, inshallah, we'll have you back on our show. You're wonderful.
My pleasure. Thank you for having me on.
Assalamu alaikum.
Wa alaikum salam.
Stay tuned to Salam Radio after this short ad break.